ashver.com.
Hello and welcome to ashver.com. You are watching an interesting and informative video on the spine and lower back pain, general information.
Please read the disclaimer carefully.
The spine. The spine is made up of 33 vertebrae separated by 23 intervertebral discs. Vertebrae are named based on the region where they are located. Cervical vertebrae are located in the neck, thoracic vertebrae attached to the ribs, and lumbar vertebrae are found in the lower back just above the sacrum. There are 7 cervical vertebrae, 12 thoracic, and 5 lumbar. A simple saying will help you remember how many are in each region. Breakfast at 7, lunch at 12, dinner at 5. Those who have already done the math recognize 7 plus 12 plus 5 equals 24. The sacrum, just below the lumbar vertebrae, and the coccyx, or tailbone, become fused as we age. Originally the sacrum is comprised of 5 bones and the coccyx 4, hence 24 plus 9 equals 33. When we are born our spine has one curve. Learning to lift our heads and crawl we begin to develop the anterior curve of the cervical spine. As we begin to stand and walk the anterior lumbar curve develops. The curves of the spine are very important. A curved spine can support 10 times more weight than a straight. Vertebral movement. The vertebral discs act as natural shock absorbers and provide space between the vertebrae. Looking at the image on the right you will see a few things. Notice that when the top vertebrae moves forward the disc below it moves to the back. The opposite is true when the top vertebrae moves back the disc material is pushed forward. Also notice the facet joints highlighted by the black arrows. These are smooth bony surfaces that glide over each other during spinal movement. If a disc is compressed, the distance between the vertebrae is reduced and the facet joints will have limited mobility, especially on extension, or bending back. Lower back pain. At any given time 2 to 5% of the world's population suffers from lower back pain. 3 in some cases the pain is only musculoskeletal. In these instances the bones and muscles are out of proper alignment so they have to work harder than normal. There is a phenomena in the body called the pain cycle. It works as a protective mechanism, but if it is not addressed it leads to further problems. Whenever an area of the body is injured or in pain the body will tighten the muscles in that area to prevent further damage. Although this helps reduce the pain, the tight area begins to affect surrounding muscles and tissues not originally involved. Bulging and herniated discs. More serious forms of back pain include bulging and herniated discs. Remember how the disc material moves posteriorly, towards the back of the body, when the spine bends forward. This is why lifting with your legs instead of your back is so important. A disc that is bulging or herniated posteriorly can press on the spinal nerves and/or the spinal cord. A disc that presses on a spinal nerve between the 4th and 5th lumbar vertebrae can cause sciatica. Symptoms of sciatica include pain in the lower back, weakness in the legs, and pain and tingling down the leg. However, the symptoms of sciatica can also be caused by gluteal muscles. Specifically, the piriformis muscle. For some of the population the sciatic nerve runs under the muscle and in others the nerve runs through the belly of the muscle. Genetics determine where the nerve is located in relation to the muscle. This is one of the reasons why gluteal massage is so important for back health. The forces generated by every step we take are transferred through the pelvis to the back. If the pelvis and legs aren't happy it is virtually impossible for the back to be happy. Without a proper foundation muscle asymmetries will develop leading to back muscle asymmetries of lordosis. When the muscles of the lower body create an anteriorly tilted pelvis it is referred to as the lower cross syndrome. Drawing an imaginary line from the weakened gluteals to the weakened abdominals creates half of the cross. Connecting the shortened iliopsoas with the shortened erector spinae makes the other half of the cross. This is a very common muscle imbalance that is the source of most back pain. Many people view their body as separate parts which are not related to anything else. In the case of lower back pain, it does not occur to most of us that our stomach is the front of the lower back. Pregnant women are the perfect example of this muscle asymmetry and lower back pain. Not only does the weight of the baby pull the spine forward, the abdominal muscles also become stretched and weakened. Since there aren't many people over 25 with abdominals toned to a six-pack, it is easy to understand why so many suffer from lower back pain. If we could travel back in time, I'm sure we would notice that cavemen didn't sit behind desks 40 hours a week. Our brains continuously monitor muscle tension. While sitting for extended periods of time, the brain detects too much slack in the quadriceps, front of the thigh, muscles. When the front of the thigh muscles are short and tight, they pull the pelvis down in the front. This causes the back of the pelvis to move up towards the spine, creating lordosis. One would think that if the pelvis is tilted forward, then the upper body should be tilted forward as well. Looking around, it is pretty rare to see people walking around bent forward at the waist. The brain also works to keep the eyes level with the horizon. So as the pelvis is tilted forward, the brain shortens the muscles in the lower back to bring the restoring balance. If you have been diagnosed with lordosis, there are a few steps you can take to help prevent further low back pain. Strengthening the weak abdominal, gluteal, and hamstring, back of the thigh, will help even out muscle asymmetries. Massage can also be an excellent tool to aid in lengthening the shortened quadriceps and lower back muscles. As the shortened muscles are lengthened, the pelvis can begin to rotate posteriorly. Look for a therapist who performs myofascial release. It's a gentle technique that addresses the connective tissue, fascia, of the muscles. Fascia can be thought of as pantyhose surrounding a muscle. If the pantyhose are pulled tight, it is virtually impossible for the muscle to occupy its optimal form and function. Chiropractic work can also aid in proper spinal alignment. In my professional experience, chiropractic and massage therapy work very well together. Since the muscles hold the bones in place, chiropractic adjustments are usually more productive after the muscles and fascia have been relaxed. Thank you for watching this interesting and informative video. This channel offers motivational, inspirational, valuable and informative videos to soothe, cleanse and inspire your health, mind, body and spirit. You can find a lot of interesting videos on wide range of topics here. Stay tuned and keep watching.